Hello, I'm Justine Whitaker. I'm a member of the British Lymphology Society Scientific Committee. I'm senior lecturer at the University of Central Lancashire, and I'm also nurse consultant and director of Northern Lymphology in the north of England, in Lancashire. And today we're going to talk about how we can write a clinical case study. I'm going to give you some advice and top tips on how to do that. So over the next 20 minutes, we're just going to look at how we can briefly identify a case. I want to give you and share a model with you that's also accessible on the British Lymphology Society website, which helps you put together a constructive case study that's meaningful and means that you don't miss anything out. Briefly on a conclusion, and then just refer to some of the BLS documents that we've talked about throughout the presentation. So why would we want to write a case study or report? Well, there's a couple of reasons. One reason why we're doing this is to encourage you to enter our competition, which from the British Lymphology Society, and there's going to be more information on that for you shortly. But one of the other reasons for doing that is to share practice with other healthcare professionals in situations where you've come across where it's pretty rare and you think it might be useful for someone else. When we look at case studies and case reports, they're often seen very low down on the hierarchy of research, but that's not to be underestimated, because actually they can be the start point of something great and big within the future. Always remember that out of little acorns grow great oaks. And when you are presented in a clinical situation with something that you can't seem to find any information on, it's very useful if somebody has been in your situation where you can go and then read their case report or case study. It may be then that other people start to realise that there's more than just you within that field with that complication. So that's when we can start to then pull numbers together and create much bigger pieces of research. So it's a really good starting point for rare cases, but it's also a very good starting point if it's your first time of dipping your toe into writing for publication or even considering doing something regarding the research of your patients. So how do we go about identifying your case? Well, I think sometimes it's pretty obvious when you're in a situation in your clinical practice. There'll be some little penny drop moment that makes you think, wow, I really need to tell other people about this. Or it may be that you found it so rare that you need to share this with other people so that if they come across it, that can help too. So at that very first initial moment where you think, actually, I need to share this, you need to start to gather systematically and logically all the information that you have around this patient. Rather than just chucking it all together, start to think of things in sequences. So in the British Lymphology Society News and Views magazine publication, in issue 116, there's quite a nice section on writing case reports. So some of what I'm going to present today is a little bit of a resume of that and a refresher, but also to give you that reference that this originally was all based on the care guidelines or the care report, which was a consensus-based clinical case reporting guideline development, so that people can start to have some coherent way of putting the information together, which then subsequently could become a series of case reports that all follow the same format. So I appreciate the writing on this slide is quite tiny. So what I'm going to do is take you through each of these individually. And as I said, they're there in the BLS for you to go back to and reference. So before we even begin, we need to think about a title. And what is a title? Well, a title explains what's going on within what you're within the piece of work that you're going to be doing. So it's really, really key at this point to make sure that the word case report or case study is within that title. And the greatest phenomenon within that, that case study that you're talking about, there could be several issues with the patient, but capture the main issue that you want to talk about and discuss. It could be a symptom, it could be a diagnostic test, or it could be an intervention or the results of an intervention. So getting those across in that title is pretty key, because that's going to capture the reader. But it's also going to be there when people do a search, when they start to look to see if anybody else has written things, when they go on to the search engines and type in the condition that you're going to be talking about. So we need to begin with an abstract, and an abstract is a brief kind of paragraph really of between 100 and 150 words, telling the reader what the content of the article is going to be. It's pretty much a summary rather than an introduction. So you need to consider the points A, B, and C on this slide. So it will need a very small introduction. What does this case add to the whole contribution of science per se? And then case B is B is the case presentation. The main symptoms of the patient, the clinical findings, the main diagnosis and interventions, and then the main outcomes. And then the conclusion, what are the main takeaway lessons from the case? So all this is combined within that 100 to 150 words. So you're capturing things from the whole paper. So often this is written afterwards so you can get those key messages out, but you are going to need to start with an abstract, particularly if you're applying to submit this to somewhere. So an introduction is kind of very revealing in that it's going to set the scene, if you like, and it's a brief background to the summary of the case. And at this stage, you would start to include referencing within the medical literature. We need to consider, whenever we're doing anything with patients, the ethics and what involvement has this patient had. The patient should have been offered a form of written consent or verbal consent, and this should be documented. But it's also important that when you are working through this case study, that the patient themselves is not identifiable. We don't need names, we don't need hospitals, we don't need addresses, we don't need necessary clinical settings unless it's relevant to the case. But it would be a generic reference as opposed to the name of a clinical setting. And the report needs to be, you need to consider whether the report includes a patient's perspective. This is not essential, but it should always be encouraged to share their experience where possible, and it's inclusive of them because it is about them. And it can be done in the text within the report of the case report, or it can be placed as a separate statement at the beginning or at the end. But try and include your patients where you can, and it helps to keep the case study very real. Patient information is important. Provide the patient's demographics. So, for example, how old they are, what their gender is, what their ethnicity is, what their occupation is, whether they've got any other factors that's relevant to the case. Describe the patient's main symptom or problem, as well as relevant medical, family and psychosocial history. All this helps to set the scene with what you're going to be discussing. Include, if possible or relevant, what the patient's diet is, what their lifestyle is, any genetic information wherever possible, any relevant comorbidities, and including any past interventions and their outcomes, whether they've been useful or not so useful, which may be what has caused the grounds for your decision with your clinical or your case study and report. Clinical findings need to be described, but also it's important to do those in a contextual timeline. So looking at clinical examination, measurements or investigations, and along with important dates and times that they occurred. And as kind of briefly hinted at, this needs to be in a chronological order. Diagnostic assessment, you're going to help the reader understand how you got to where you were describing why this patient has this problem. So we're going to look at including diagnostic methods, for example, a physical examination, laboratory testing, imaging, questionnaires, anything that's helped them, helps you get to that point with that patient so that they understand why they've got the issue. And then we can start to look at diagnostic challenges. It may be financial, it may be, there may be a language issue, there may be cultural differences that are not necessarily catered for or need to be catered for within this case study. And any prognostic characteristics, for example, trying to stage the disease where possible. Therapeutic intervention may well be a part of your case study, and if that is the case, then you need to describe the types of intervention used. Would it be pharmacological, surgical, preventative, decongestive lymphedema therapy, self-management? It may be one of those or it may be all of those, but they need to be included and discussed. Also, the administration of these needs to be included in your text. For example, the dose, the strength, the duration, how often the treatments were given, how often did they have to attend clinic, were there any challenges or changes that occurred within that collection of the information that may have altered the outcome. Everything needs to be put in within this intervention group, and also if any changes in the intervention that occurred during the procedure, the rationale for that needs to be applied rather than just expecting the reader to guess why you've changed things as you've gone along. Rationale is a really key part of explaining why you're doing something, as opposed to just telling people that you're doing it. So the follow-up and outcomes part of your case study and report is a summarisation of the clinical course of all the follow-up visits and appointment times that you've seen these patients. So there will be clinician and patient assessed outcomes. It's important to follow up test results, either if they're positive or negative, and include those in the text. Don't leave things open to guessing and wondering. Intervention, adherence and tolerability, and how this was assessed. And also what's really key is any adverse and unanticipated events that may have occurred during the collection of the information you've put together for the case study and how they were dealt with. If there was a problem, don't leave it out. It could be absolutely key and relevant to that individual case, but also incredibly useful for other readers once this work's published. Because it may be something about this particular case that continues to be a familiar picture that starts to occur, which then just gives your case study so much more ground in the future when people then start to pull these pictures together to build on further research. So finally, we need to conclude and discuss the piece of work that you've worked incredibly hard on. And the discussion should include the strengths and limitations of the management of the case. Don't be shy, put your heart on your sleeve, explain what was good about it, what was hard about it, what wasn't so good about it. Discuss the relevance of the published medical literature. How does what you've done and found tie in with what's already existing? And even if that means that you found something out that towards the end that would have made a difference to what you've done, put it in at this point and include it, because it's relevant and it's vital for other people to build on. Provide a rationale for any of your conclusions that you reach, including any cause and effect examples. If something's happened as a result of your intervention, give that rationale as to why you think that's happened. Or if something didn't turn out to be what you expected it to be, again, give some rationale as to why you think that might be the case. And finally, it's really good to have a take-home message from a case study or a case report. Sometimes that's this needs further research. That's often always a standard sentence in these things. But also it could be that it's been an incredibly important intervention for your patient, and the lessons that have been learned from that is that, yeah, we'd go straight ahead and practice doing this intervention with all patients from now on, or it's changed practice within clinic. We're not talking about huge protocol changes off one case study, but there could be just some little pearl of evidence that's come to the point within your case study and report that's so key that you really must share and have that intervention with future patients, and also with colleagues as well, depending on what you're reporting on. So that's our conclusion, really. So the article's really that to kind of get a grasp of everything we've talked about today, if you can go on the British Lymphology Society website and click onto the resources that are available, and you can then download all the news and views that have been published in the past. The scientific committee are very active within the news and views journals, and the one that's really key to today's discussion is 116 issue. So I hope you found that helpful. If you're not a member of the BLS, we invite you to be. And if you're just dipping your toe in for the first time with us, then there's the opportunity for you to join us as a friend. So I'll call off here now because there's lots of other exciting things to tell you about within this webinar. So thank you very, very much for joining me today, and good luck. And I look forward to seeing your case studies in the future. Thank you.